Hi friends, I am Dr. VENUMADHAV. Welcome back to my channel, Dr. VENUMADHAV's Learning Anatomy. Today as a part of it, we will learn something about the clavicle. The clavicle is a subcutaneous bone present above the rib cage and it connects the sternum with the scapula. It is a type of the long bone and is a modified type. Why it is modified? All long bones are placed vertically in the body, and this bone, if you see, that is placed horizontally. You can see the highlighted bone which is placed horizontally above the rib cage and shoulder. So this bone does not have a medullary cavity, and it has trabeculae, that is spongy bone is there, and which is filled by the bone marrow. The specialty of this bone is, this is the bone in which the ossification centers start first in the uterine life, and it is the same bone in which the ossification completes last after 21 to 25 years of age. So this is a special bone, and this acts as a strut, that is a lever, to hold the hand and to allow the hand to move around the shoulder joint. So today we will see about this bone. If you see this bone, this is subcutaneous, that is under the skin, and it is covered by the platysma muscle, the brown sheet of muscle you can see, that is over the clavicles, which are seen as some folds in the lower part of the platysma. So after removing a platysma, entire bone is subcutaneous. The platysma moves freely over this bone, and that's why the surface of the bone is also very smooth. So if you see, it is the clavicle appears as if the italic letter F, and which is present horizontally. So that is the bone, and if you see the parts, it has two ends. One end is two ends. One end which connects the sternum is called medial end, and the end which is connecting the acromial process is called lateral end. I want to show you the real bone here. So this is the clavicle bone. If you see, this is like a italic letter F, and you can see there are two ends. So this is one end, this is the end, this is the other end. If you see, this end is connecting to the sternum of the axial skeleton, and this end is connecting to the acromion of the scapula. So this is the sternal or medial end, this is the lateral end or acromial end. And if you see here, this is the bone. So you can see two surfaces. One is the superior surface. This is the superior surface. Here I want to show you the superior surface again. So this is the superior surface, and if you turn it down, this is the inferior surface. If you see the superior surface, which is almost entirely subcutaneous and presents rough surfaces at the ends where the muscles are attached. In the center, it is subcutaneous and covered only by the platysma, so it is very smooth. So if you see, this is the medial end. The medial end of the clavicle is somewhat quadrangular in shape, and it is broad also. You can see this is the medial end. So if you see it, this surface presents a curved surface. So that is convex above and concave, is mild concavity is present here. So this forms a saddle type of synovial joint with the sternum, which the joint cavity, when there is a synovial joint, there will be a joint cavity, and that joint cavity is separated by means of a fibrous articular disc into two complete compartments. And at the same time, if you see, there is a small ridge here. So the lower part of the clavicle is forming the sternoclavicular joint here, but the upper part projects above the sternum. I want to show you here. So this is the medial end, and you can see here, this is the medial end, and this is the sternoclavicular joint. So here you can see the clavicle is above the manubrium, where the two upper surfaces are connected by interclavicular ligament, a ligament connecting two clavicles from the, so it is connecting the upper surface of one clavicle with the upper surface of the other side clavicle. So two clavicles are connected by interclavicular ligament. If you see here, this is the surface which is forming a saddle type of joint. If you see the muscle attachments to the superior surface, that means the upper surface, you can see here the sternocleidomastoid muscle which belongs to the neck here, from here to the mastoid process present behind the ear. So there is a big muscle is here. So it has two heads, a sternal head and the clavicular head. The clavicular head originates from the, so if you see that this is the surface, superior surface, here this is the place where the sternocleidomastoid takes origin, and this is the place for the clavicular head of the sternocleidomastoid, that is the origin. So if you see a little bit anterior here, this part gives origin to the fibers of the pectoralis major. The pectoralis major is a broad sheet of muscle present on the pectoral region and its upper fibers originate from the this anterior superior part of the clavicle. And if you see the posterior side of this clavicle, you can see a triangular depression is here. So this place, this triangular depression gives origin for the sternohyoid muscle. Few fibers of the sternohyoid which actually originates from the sternum. So that muscle originates from this triangular depression on the anterior-posterior surface of the or superior-posterior surface of the clavicle. If you turn the inferior side, the medial side presents a oval rough area. You can see here very roughness is there, because here the sternum is here, the first rib attaches to the sternum there, and there is a strong ligament between the costum, that is the first rib, and the rough area here. So here you can see this is the place for the attachment of the costoclavicular ligament. So this is attaching here. So this is about the medial end. If you see, the entire bone presents two curvatures. One curvature which is anteriorly convex, one curvature is posteriorly convex. So if you see the and this entire bone can be divided into three parts. This is one part, the lateral 1/3, middle 1/3, this up to here, middle 1/3, and this is the medial 1/3. So if you see, the medial 1/3 and the lateral 1/3 gives attachment to the muscles, and the middle 1/3 is subcutaneous, covered only by the platysma, but it is not attaching to this. So that's why these two parts are presenting rough markings on the bone. If you see here, if you see the shaft, this is the shaft. You can see the superior surface is completely subcutaneous. Here, this curvature, the concavity which is present behind, is protecting the subclavian vein, subclavian artery, brachial plexus nerves, which are the nerves. So all are passing behind that, and that is why it is also, its function is also protection. So here if you see the inferior surface here, it presents a long groove here. You can see along the longitudinal axis there is a groove here. So this groove is for the origin of one muscle which is present below the clavicle, what we call subclavius muscle. So this is also called as subclavian groove. And the lips of, so this is one lip, this is another lip. So these lips give attachment to the clavipectoral fascia, which is the deep fascia of the thorax. So if you see the groove towards its lateral end, there is a foramen here. So this is the nutrient foramen, and it is directed to the lateral side. That means the growing end is towards the medial side. So this is called subclavian groove, and in which the subclavius muscle is present. If you see, the lateral end of this groove ends at a round tubercle. You can see its shape now. So this is the tubercle here. So this is called conoid tubercle. So this is the conoid tubercle, and if you see the inferior surface from this conoid tubercle, a rough area is a rectangular or the trapezoid ridge, what we call, because this is somewhat trapezoid shape. So this is called trapezoid ridge. So if you see, this end is attaching to the acromion process. This is the scapula bone, and this is the acromion process. So if you see the acromion process, there is a facet here. This is for the articulation with the clavicle, like this. So this is how they are attached here. So this is how. So if you see below them, this is the coracoid process. So from the coracoid process, there is a strong ligament which is coming to the clavicle and attaching to from here to the here. So this place, the part of the that ligament is called coracoclavicular ligament. So the part of the coracoclavicular ligament which is connecting the conoid tubercle here, and there is another tubercle here on the coracoid process also. So this is, you can see, this is the coracoid tubercle, conoid tubercle. So the part of the ligament which is connecting both conoid tubercles is called conoid part of the coracoclavicular ligament, and the part which is attached to this trapezoid ridge is called trapezoid part of the coracoclavicular ligament. So this entire thing is for the attachment of the coracoclavicular ligament. If you see the lateral end, it is somewhat flatter from end. It is from above downwards. It is flatter and presents an anterior border and a posterior border. So you can see this anterior border and a part of the superior surface up to this curvature, it gives attachment to the origin to the anterior fibers of the deltoid muscle. The deltoid muscle which is present lateral to the shoulder. So its anterior fibers originate from this border, and the posterior border gives insertion. That means it gives attachment to the fibers of trapezius. The trapezius, a big diamond shaped muscle present on the back, and its middle fibers, they come here and connects to the posterior border here. So this forms the joint with the acromion process here. So these are the attachments present in this region. So if you see, I want to show all these things here. You can see on the medial border and medial surface, you will see the attachment of the superior surface. You can see sternoclavicular head, and the sternoclavicular ligament is also there, which is connecting the anterior surface. So there are two sternoclavicular ligaments, anterior sternoclavicular ligament and posterior sternoclavicular ligament. They connect the sternum with the clavicle, and the superior surface gives attachment to the clavicular head of the sternocleidomastoid, and a little bit posteriorly you will see, because from the sternum to the hyoid bone, there is one muscle is coming like this. So that is called sternohyoid muscle, that is originating there. So if you see, this is the oval surface area on the inferior surface, and which gives attachment to the costoclavicular ligament. This is the articulating surface which is forming the sternoclavicular joint, and this surface is covered by the fibrous cartilage. This is the sternoclavicular joint. You can see the upper part of the clavicle is above the sternum, and this joint space is also separated by means of an articulating disc into two chambers. So here, this is another view where you can see the interclavicular ligament and the sternoclavicular ligament, which is also known as anterior capsular ligament. So here, this is the lateral end, acromial end, the rough end superior surface. The anterior border is concave and the posterior border is convex. The anterior border gives attachment to the, or it gives origin. Origin means from where the muscle takes birth. So it gives origin to the anterior most fibers of the deltoid muscle, and posterior border gives attachment for the trapezius muscle, which is present on the back. So this is the inferior surface where you can see the elevation on the left side, that is conoid tubercle, which is continuous towards the end as the trapezoid ridge. So this roughness gives attachment to the trapezoid ligament and the conoid part and trapezoid part of the coracoclavicular ligament. You can see the facet there, the depression on the articulating surface, and here this is the acromioclavicular ligament, where you can see the coracoclavicular ligament. The two parts are there, the conoid part and the trapezoid part are there in that bone. So this is how the clavicle is attaching to the acromial process. So this is the entire shaft. You can see from medial end on the left side to the acromial end on the right side. By the curvatures, if you see, the 2/3 of it is curved with convexity on the anterior side, and the lateral 1/3, which is on my right, is concave anterior. So the medial 2/3, which is convex anterior, should be placed towards the sternum, and the anterior the lateral 1/3, which is with the anterior concavity, should be placed on the lateral side. And if you see the entire superior surface, that means the upper surface, which is very smooth. If you see the same bone, the inferior surface, that is the lower surface, is having some ridges, tubercles and groove. That means it is very rough. And if you see, that groove should be placed onto the lower side, because that is for the subclavius. So this is how you place the bone in an anatomical position during the MBBS examinations, or that is how anatomical position means, that is how it is present in our body. So that is how it is. So this is the shaft. You can see the upper surface is very smooth, and the lower surface presents the subclavian groove, the longitudinal groove for the subclavius muscle. The towards my right is the you can see the nutrient foramen just in front of the conoid tubercle, and this groove continues into the conoid tubercle. So that that nutrient foramen is also directed towards the lateral side. That means the growing end of the bone is the medial side, and this is the the subclavius muscle. You can see it is present a triangular muscle which is present under the clavicle, and it inserts onto the first rib. So these are the muscles which are attached to the what we can call, this is the superficial view of the muscles which are attached to the clavicle. If you see the big sheet of a triangular sheet of muscle below the clavicle is the pectoralis major, which is covering the front of the chest. That is also attaching to the medial 1/3 of the clavicle there. So that is the sternocleidomastoid muscle, and you can see the green triangle above, that is the trapezius muscle. That muscle is the attachment of the trapezius muscle, and towards the that means towards me, you can see the clavicular head of the sternocleidomastoid muscle is also there. The deltoid muscle, which is present on the shoulder, that is also attaching to the lateral end of the clavicle. So that's why the middle 1/3 part forms the base for the posterior triangle, and also a deltopectoral triangle onto the axilla. So here we will see these are the markings of the muscles. You can see the green muscle, which is for the insertion, trapezius muscle, and into the concavity, the deltoid muscle. Towards me is the medial and sternohyoid muscle is there, the sternocleidomastoid muscle, and the ligaments are also there. So these are the muscle arrangements. You can see the ligaments of the joint. You can see towards the sternum is the anterior sternoclavicular ligament, the posterior being on the other side, and below that costoclavicular ligament, that is between the first rib and the clavicle. On the lateral side, you can see acromoclavicular ligament, which is connecting the two bones which are joining the acromion process and the lateral end of the clavicle. Acromoclavicular ligament will be there, and from the coracoid process, one ligament goes to the acromion process, that is coracoacromial ligament, and two ligaments, that is, you can see the coracoclavicular ligament the coracoclavicular ligament, which is having two parts. One part is connecting to the conoid tubercle, that is conoid part, and the other part is connecting to the trapezoid ribs, what we call trapezoid part. So these are the ligaments. So as the curvature is present between medial 2/3 and the lateral 1/3, this is the vulnerable point for the fractures. If a person falls on the stretched hand or on the shoulder, that impact causes the bone to be fractured at the junction of the medial 2/3 and the lateral 1/3 bone. So this is about the clavicle. The blood supply is by the branches of the thoracoacromial artery, and one you can see in this bone, you can see here a small foramen is seen here. Here this is small, this dot is a foramen, so into which the middle or the intermediate branch of the supraclavicular nerve may be pierced. It is occasionally pierces this bone and comes out, because this is a cutaneous nerve of the neck. So this is all about the clavicle. So please like this video, and you can comment your questions, doubts, or anything in the comment section, and please share this video to your friends so that my channel can be improved. And also please make everybody to subscribe to this channel. Thank you very much.